So 10 years ago, I went in for what I considered a routine joint replacement, a knee replacement. Now this was my 5th joint replacement. I was a very healthy person, but I had poor joints. I had joints replaced. This joint I was having replaced because I wanted to go to Rome. I wanted to walk Rome, and everything seemed to go well. But about 2 weeks later, when I was having the staples removed, there was some oozing, and that led to a very serious infection, and they had to remove the joint, put in a new joint, and that continued to happen that way for the next, well, basically 8 years it took until the wound finally healed shut. And then it got to probably another 6 months after that, and they said, we're going to have to amputate now. All I wanted to do was to learn how to walk again with an artificial limb. And the people in rehab center kept saying to me, your wound isn't healing. There's no way we can get a prosthesis. That was like the end of me being able to do my job because I needed to be able to drive. Those 8 years changed our lives forever. You know, I lost a job because I couldn't do it anymore. Your financial security is gone. We had to move. We couldn't stay in our home. We had to change home because the home we were in, my wheelchair wouldn't go through the doors. Some of the things that I lost was a lap, and you might think that's minor, but for my granddaughter, not being able to sit on her grandma's lap was important. I'm doing this because I don't want anybody else to ever deal with what I'm dealing with. The first time I ever shared my story in public was with 200 people in leadership in the hospital, the healthcare facility, where I had my first knee surgery. Not ready to say no to anything yet. If people want me to share my story, I'll be there. I'll do it. I always say if I can tell my story and one person doesn't get an infection because of my story, then I did my job. It is not the life I expected to have at this point in my life, but it is the life that I have, and I'm going to make the most of it.